What do Sjogren's patients need to focus on? Just like a lot of autoimmune patients, we need to focus on inflammation. Our autoimmune disease, what happens with our autoimmune is it's overactive. Okay, so when it's overactive, what it does is it attacks healthy tissues. For us specifically, what it attacks that sets us apart. This is not Sjogren's disease. All we hear is dry eyes, dry mouth. No, it's just what sets us apart from other autoimmune disease. But really, it's a systemic disease, meaning it affects the entire body. It is a musculoskeletal disease, and that affects your muscles, your tendons, your ligaments, your discs, your blood vessels. It is sort of all-encompassing. It's also rheumatic, which is why people experience pain and swelling and inflammation in their joints, their muscles, anything that's connective tissue, because it's a connective tissue disease. So even though doctors fail to sort of mention this, they sort of minimize it, if they even admit you have it. They minimize Sjogren's, like, oh, dry eyes, dry mouth, which is sometimes kind of the least of our problems, depending on the day and the flare-up. So I would just want you to really understand that when your autoimmune is overactive, it's because of inflammation, right? So the more inflammation we have in our bodies, the higher our C-reactive protein and sedimentation rate is going to be. Those are the two markers on your blood work that you need to really pay attention to. And inflammation is what we're battling. I don't know why doctors and rheumatologists just don't say this from the get-go. Instead, they want to give you drugs. They want to give you prescribed medications that oftentimes are only hurting the quality of your life and hurting your disease farther. So if you're on things like gabapentin for pain, this isn't good. If you're on statins, look at the cholesterol. We need cholesterol. The older we get, you got to kind of branch out of some of this old information. Statins eat your joints. That's the last thing you want as a Sjogren's patient. Their joints are already compromised. Okay, you don't want to be on hardcore drugs, methotrexate. There's just so many I could go down. The average person with autoimmune disease is on 8 different medications. And are they helping? This is the problem. They're not healing you. They're not doing anything. The only thing that is actually going to help you, okay, now listen, I understand some people, it's a spectrum and people are all over the place. And if you're really, really sick, you need to do what you need to do. I'm not a doctor, so I'm not telling you not to be on things. What I'm telling you is that, especially if you're younger and you know you have Sjogren's disease, you can actually treat yourself by treating your inflammation. And don't get me wrong, I am on hydroxychloroquine and LDN therapy. Those have helped me significantly. I can now live like a normal person on top of all the work I've done to bring the inflammation down in my body. I'm able to live life like a normal person. All my markers are now normal. It took me a couple years to understand this and why doctors don't just say, listen, it's all about inflammation. Look at your C-reactive protein, look at your sedimentation rate, and year after year, you want to see those numbers going down by diet, exercise. I don't even exercise that much. Most autoimmune patients have a hard time with that. We're what they call exercise resistant. But getting good sleep, look at the studies on sleep. Look at the studies on de-stressing yourself. I know that's easier said than done. Sometimes it's easier to work out than it is to de-stress. And sometimes that is a de-stressor. I take a lot of supplements and do a lot of holistic type treatments for inflammation. So just remember, all these medications you're on, or if you're feeling dismissed or you don't really understand Sjogren's disease, start looking at inflammation within your body and bringing the inflammation down in your body. That LDN therapy, by the way, is like a miracle. You need to look into that. It brings inflammation down a lot. I know some doctors want you on metformin or GLP, but I really highly suggest you to try LDN therapy first because there's 0 side effects long term. Hopefully hydroxychloroquine works for you because also the side effects are really low comparison to some of the other medications out there. But remember, it is systemic, it's rheumatic, it's musculoskeletal, it's a connective tissue disease. And what are we trying to do? We're trying to treat inflammation and bring inflammation down. Hopefully, as holistically as possible. So sometimes you have to step away from what your rheumatologist and your doctor is telling you, or the lack of what they're telling you, and really, really, really start looking at to what your autoimmune disease is. We need to slow it down. It's confused. Something like hydroxychloroquine is going to slow down your autoimmune disease. it's going to slow it down. Basically, it's confused, so maybe it gets less confused and it doesn't attack. So you get less flare-ups. Same with LDN therapy. It brings your inflammation down. Look into that, please, 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 please. And I hope this helps somebody. God bless you.